Yang Qing, alias, is a Wuhan resident whose husband went to the hospital on January 10th for diabetes and died on January 25th. He was tied to a bed with a hospital note stating in a coma. According to Yang Qing, he was crying and in pain for 3 days until the day he died. He was over 40 years of age.
What was the cause of the death? Wasn't it confirmed with the test?
It was said to be severe pneumonia. There was no confirmation of the coronavirus infection.
Which hospital did your husband go to?
Wuhan Central Hospital.
Can you describe what was going on in the hospital and the treatment involved?
After about 7 days in the hospital, he was admitted to the ICU because the doctors said his diabetes was quite complicated. He didn't have a fever. Around January 19th, the hospital notified us that the ICU would be shut down. No one explained why. When the doctor said to transfer him to the general ward, I thought he was getting better. In the general ward, I would need to keep him company every day. Every day he had a high fever.
What's the temperature?
Above 39 degrees Celsius. He started having a fever on January 20th, but he was still consuming some liquid food. On the 23rd, they told me his blood pressure was too low and asked me to sign a bunch of papers. I had no clue what I was signing. It seemed like a bunch of consent letters for critical condition, rescue procedures, and so on. I thought, as long as he's saved, I just signed them all. I kept on asking them to transfer him to the ICU, but they said the ICU won't take him. I was really sad. At the beginning, I requested dialysis, but they said he was only having mild pneumonia. 10 days later, they told me with or without dialysis, he's going to die. I had signed everything they wanted me to, but he's only getting worse every day. He kept groaning in pain for days. They had me buy dementia gloves to keep his hands and feet restrained in bed.
Why would they keep him restrained?
He said he was feeling very ill. They did not do anything except just keep him tied up to the bed. He was groaning the entire time. The hospital said he was dying. The nurse even wrote that he's in a coma. But he was crying out the whole time, day and night, from the 23rd to the 25th. Until he passed away, he was still tied up to a bed, both hands and feet.
That's really sad. How many days was he tied to the bed?
3 days.
Were the patients in the ward all infected with pneumonia?
No. There were also cancer patients.
What was in your mind seeing him tied to the bed?
I was crying the entire time. There's nothing I could do for him. The doctor told me I should be content because at least he was in the ward. After he died, the hospital asked me to pay in full. Otherwise, there's no death certificate. I wanted to keep the body in the cold chamber of the morgue, but they said the government demands immediate cremation regardless of the cause of death. They said it's a crime if I didn't cremate him right away. I was too frightened to judge, so I agree with a cremation.
The regime covered up the outbreak in Wuhan. It would not recognize human transmission of the CCP virus until January 20th. During that time, many people visited hospitals for other illnesses and then died after contracting the virus. The interview was conducted on April 13th by Hong Ning of the Chinese-language Epoch Times.